Imagine living with a virus and not even knowing it. Imagine carrying something that could lead to cancer, not just in you, but in your partner too. And yet, there are no symptoms. This isn't a rare case. This is the reality of HPV, human papillomavirus, in men. While most discussions around HPV focus on women and cervical cancer, the virus also hides in the male body, quietly spreading, often undetected. Today, we'll walk you through the essential truth about HPV testing in men, the symptoms you may never notice, the accuracy of swab tests, and what it really feels like to get tested. Let's break the silence. What is HPV and why it matters for men? HPV, or human papillomavirus, is one of the most common sexually transmitted infections in the world. It's estimated that nearly 80% of sexually active people will get HPV some point in their lives. While women are routinely screened for HPV due to its link with cervical cancer, the reality is that men can carry and transmit the virus too, often without any symptoms. In men, HPV is linked to genital warts, penile cancer, anal cancer, throat or pharyngeal cancer. Despite the serious risks, there is no routine screening for HPV in men, unless they fall into a high-risk category. That's why awareness, testing, and prevention are so critical. Can men be tested for HPV? Yes, but there's a catch. Many people assume that testing for HPV human papillomavirus is just as routine for men as it is for women. But here's the truth. Yes, men can be tested for HPV, but the process is far more complicated and often not offered at all unless you belong to a high-risk group. Let's break it down. Number 1. No standard test for all men. Unlike women, who receive routine cervical HPV testing during pap smears, there is currently no FDA-approved general screening test for HPV in men. That means you won't be offered an HPV test during regular checkups. Most doctors don't routinely test men unless there are symptoms or high risk involved. Number 2. Swab tests do exist, but are limited. There are swab-based HPV tests available for men, but they're not widely used. Anal swabs are most commonly done, especially for men who have sex with men or men living with HIV, because these groups face higher risks of HPV-related cancers. Throat swabs may be used to detect oral HPV, but usually in research settings. Penile swabs to check for genital HPV exist, but they're not part of standard clinical practice. This means that unless you fall into a high-risk group, it's unlikely your doctor will recommend or even offer an HPV test. That needs to change, and many experts are pushing for it. Swab testing, how it works and what to expect. You might be surprised, HPV swab testing in men is more precise and less invasive than many assume. While it's not part of routine checkups yet, here's exactly how each test works. A small, soft medical swab is gently inserted into the rectum to collect a sample of cells from the anal lining. The test takes less than a minute. It's not painful, but may feel slightly uncomfortable. Often used for men who have sex with men or those living with HIV. Here, a swab is rubbed along the penile shaft, under the foreskin if uncircumcised, around the glans head. This collects any potentially infected skin cells where HPV tends to live. It's not widely available, but may be offered in specialty or clinical trial settings. This is much like a routine strep throat test. A soft swab is briefly inserted to the back of your throat. It collects mucosal cells for lab testing, often done when oral symptoms or high-risk sexual activity are involved. None of these tests require anesthesia, and you can usually go about your day right after. Results are typically ready within a few days. But here's the problem. Many doctors don't perform them unless you ask, and even then, they may be hesitant if you're not in a known high-risk group. How accurate are these tests? HPV tests are surprisingly reliable when done correctly. Anal swabs have a sensitivity rate of over 80% for detecting HPV strains linked to cancer. Penile swabs vary more, depending on technique and lab protocols, but some research shows good accuracy. Throat swabs are still being studied, but have shown promise in early detection of oral HPV. However, false negatives can happen, especially in the early stages of infection. That's why regular testing in high-risk populations is recommended, even if you feel fine. The real issue isn't accuracy, it's accessibility. These tests exist, they work, but most men don't even know they're available. What if you test positive? What happens next? Let's say you get tested, and you're positive. What then? First, don't panic. HPV is incredibly common. Most infections go away on their own within 1 to 2 years without treatment. Your immune system clears them naturally. But in some cases, the virus stays dormant, and that's when it can lead to complications like genital warts, anal or penile cancers, or pharyngeal cancer. Treatment options include topical creams or cryotherapy for warts, surgical removal of precancerous lesions, monitoring for any cellular changes. There's no medication that can completely cure HPV, but managing symptoms and monitoring for cancer is crucial, especially if you're older or immunocompromised. Why men are often left out of the HPV conversation. The uncomfortable truth: men have been sidelined in HPV awareness. There's no pap smear equivalent for men, no annual screening. And yet, men carry and transmit HPV just as often as women. Many men don't know HPV causes cancer in men, don't know how to protect themselves, don't realize they can spread it to partners. This silence leads to delayed diagnosis, spread of high-risk strains, poor prevention practices. It's time to include men in the HPV narrative, not just as carriers, but as people directly affected by this virus. Can men prevent HPV? Yes, and here's how. You're not powerless. Here's what you can do right now. Get the HPV vaccine. Gardasil 9 is approved for men up to age 45. Use protection. Condoms reduce risk, though not 100%. Limit sexual partners and know your partner's history. Avoid sharing razors, towels, or objects that touch genital skin. Ask your doctor about testing, especially if you're in a risk group. Vaccination is your best defense, and millions of men are still eligible. It's not just for teens, it's for adults who want long-term health and peace of mind. Final message: men, it's time to speak up about HPV. HPV isn't just a woman's issue. It's not something to hide from, and it's not something to feel ashamed about. Men are affected, men are carriers. Men can also be advocates for their health and their partner's health. Testing is available. Vaccines are effective. Treatment exists. The only missing ingredient: awareness. So talk to your doctor, talk to your friends, and take action. Because the silent virus doesn't have to stay silent anymore. If this video helped you understand HPV testing, don't keep it to yourself. Share it with someone who needs to see it. Subscribe now for more clear, stigma-free men's health education, because awareness saves lives.